My name is Kelly Gibson, and I'll be your moderator for this program. Now I'd like to introduce our speaker for the webinar. Becky Jones is Special Assistant to the Executive Director at the Pennsylvania Patient Safety Authority. In this role, she created and oversees the innovation program and facilitates ongoing use of creative problem-solving methods to break through patient safety challenges. She also works closely with the authority's Executive Director to establish strategic goals and objectives for its programs and leads its strategic focus on improving diagnosis in healthcare. Becky is a certified professional in patient safety and healthcare risk management. Prior to joining the authority as a patient safety liaison in 2015, she served in various clinical, legal, and administrative roles as a registered nurse. Becky, now I'll turn the program over to you.
Thanks, Kelly, and thanks to all of you out there joining us for this webinar today. I'd like to start by telling you a story about the caterpillars you see here on the screen. In Tim Herson's book, Think Better, I learned about some research that was done back in the late 1800s by an entomologist named Fabre, who was just fascinated with these caterpillars and studied them for years. The species is called the processionary caterpillar because of the way that they travel when they leave the nest to find food, in a single file line, head to tail, in groups of 100 or more. The lead caterpillar spins a fine trail of silk, and the second in line walks along the silk for traction, and it adds its own, and this continues down the line. There's nothing special about the caterpillar at the front of the line. If it's removed, the next in line simply continues along searching for food, and the others don't really know or care about the changes that are happening at the front of the line. So Fabre conducted an experiment to test the strength of the caterpillar's instincts and to also find out what might change if he arranged them in a circle instead of a straight line. So he lured them up and around the rim of a large pot so that they formed a closed circle. And the one that had been at the front of the line was now walking directly behind the one that had been at the very back, meaning that there was no longer a lead caterpillar. They walked around the rim of the pot like this for 6 days straight, just following the threads laid down before them. During this time, they never noticed the food that was less than a foot away from them in the center of the pot. Eventually, some of the caterpillars collapsed from exhaustion, breaking the chain. Only then did the surviving caterpillars crawl off the rim to the food in the center of the pot. Amazingly, these caterpillars walked the equivalent of 90 human miles over 6 days without any food or water. Fabre found that despite the lack of water, food, shelter, and energy, these caterpillars thoughtlessly continued around the circle, clinging to the silk ribbon they had covered hundreds of times because they lacked the basic sense of reason that would tell them to do anything else. So, as humans, do we have anything in common with these caterpillars? Certainly our cognitive abilities are much more advanced. However, think about how many things you do every day that you don't give a second thought. It's human nature to stick with what we know and continue doing things the way they've always been done, especially if everything seems to be going okay. Often we only take the time to think differently about our challenges if something extreme happens, like the caterpillar collapsing and breaking the chain in the experiment I just told you about. So why is this? Well, we have a lot going on, and thinking differently takes time. It's comfortable and easy to do what we know, and thinking differently can be challenging. Keeping up with the status quo feels safe, and change is risky. However, I would argue that staying in place can be even riskier. Now let's talk about healthcare. Do we use enough creativity in healthcare? What about patient safety? There's really no doubt that we've made some great progress over the last decade in patient safety, but people are still dying as a result of healthcare that's meant to heal. I think at this point we're facing an important decision. Should we continue doing what we're doing, or is it time to explore some new, more creative approaches to address our patient safety challenges? I believe that creative thinking could lead us to patient safety innovations that will help us to adapt to the changing healthcare environment and take us to the next level of patient safety, to a level we never knew was possible before. Within the Patient Safety Authority, we've really embraced this philosophy, and innovation has become a permanent fixture in the work that we do. For almost a year now, we've been utilizing creative problem-solving methods internally to discover new and improved ways to enhance our services. At this point, we'd like to work with all of you to explore the use of these methods and tools to develop new insights for patient safety in Pennsylvania. In the 30 minutes we have together today, I'll provide you with a high-level overview of innovation and the creative problem-solving process, and help you to understand how these techniques can lead to innovations in patient safety. Let's start by defining creativity and innovation. At the heart of both of these is the desire to seek new ideas, possibilities, and solutions. Creativity involves imagination, self-expression, and problem-solving. Creativity is in the mind and revolves around thinking. For this reason, there's very little risk involved with creativity. Innovation, on the other hand, is all about action. For innovation to exist, something new must be done. To say it another way, innovation is putting creative ideas into action. And as a result, innovation is much riskier than creativity is. There are many types of innovation, such as product, service, experience, structure, and process innovations, among many others. Some people think that innovation has to be crazy, disruptive, and entirely new to the world, but that's just not true. For example, checklists were used in aviation for a number of years before we started using them in healthcare. However, since they were a new approach in the healthcare setting, they were innovative. If you search for the definition of innovation, you'll find that there are many different versions out there. Within the authority, we wanted to create our own unique operational definition of the term, and you can see that here. We define innovation as identifying and implementing novel solutions that provide value and result in positive change. Before we talk about anything else, we need to cover some important concepts you should acknowledge and understand about creativity. Before the webinar, you all answered a poll question that asked if you're creative. Let's see here what the results show. So it looks like about maybe 70% of you or so feel that you are creative, and about 30% think that you're not. Well, for those of you who said you're not creative, I'm sorry to tell you, but that's the wrong answer, because everyone is creative. This doesn't mean that we're all equally creative. Creativity does come more naturally to some people. The good news is that creative ability can be improved with practice, and by the end of this webinar today, you'll have quite a few things to practice with. Next, you need to overcome any fears you have related to creativity. Some people cringe when they hear the word and think it's too playful for the business world. However, the results of an IBM Global CEO study from a few years ago show something very different. In response to that survey, more than 1,500 CEOs from 33 industries, including healthcare, ranked creativity as the most important leadership quality above any other. Two of the most common fears associated with creativity are the fear of being judged for sharing an idea and the fear of failure. These fears are problematic because they create barriers that limit our creative potential. It's easier said than done, but you really need to identify and overcome these fears if you want to be an effective creative thinker. Organizational and team cultures play a critical role in helping to make this happen as well. When working in a group, you need to create a safe space for people to share their ideas without the fear of being judged or the fear of being wrong. The next foundational concept is to recognize common patterns of thinking called cognitive biases, which are involuntary patterns of thinking that distort our perceptions and cause us to make mistakes in logic, reasoning, and decision-making. While cognitive biases are a normal part of being human, you need to learn to recognize and overcome them in order to maximize your creative potential. We could spend a whole day just talking about the many cognitive biases that exist, but today I'll just touch briefly on two that often impact creativity. One is confirmation bias, which is our tendency to seek out evidence or interpret information in a way that's consistent with what we already believe. For example, when diagnosing a patient, a provider might ask questions or focus on information that confirms what he or she already has in mind as the likely diagnosis for that patient. The other here is conformity bias, which occurs when the ideas or opinions of the majority influence how we think, even when the choice of the group goes against our own judgment. This happens when the perceived need for agreement prevents us from sharing and exploring alternative perspectives. You may have also heard this referred to as groupthink before. Another pattern of thinking that can limit creativity is making assumptions. In his book, Thinker Toys, Michael Michalko describes how Thomas Edison would invite potential employees to his home for soup before deciding whether to hire them. Anyone who salted the soup before tasting it would not be hired because Edison refused to have anyone on his team who made too many assumptions. Before we can enter into creative thinking, we need to eliminate any preset assumptions we have about the topic. The key to overcoming assumptions is to practice challenging your common ways of thinking about and doing things. Ask yourself things like, what if there was a different way to do this? What would that look like? Or what if I were to do the complete opposite of what I'm doing now? Next, I'd like you to imagine you were asked to draw a quick sketch of a tree. Take a few seconds to see the image in your mind. So right now, you should be picturing what your sketch of a tree might look like. Okay, got it? So this sketch would have looked something like this. I'm going to guess that most of them would have resembled this sketch. So why is this? Well, it's because it's the perspective that we're used to. In order to be creative, you need to learn to view things from multiple perspectives. What are some perspectives that would have resulted in a different sketch of a tree? Well, you could have thought about it in terms of the season, or you could have focused on a certain part of the tree, like the trunk or just a single leaf. You also could have considered the vantage point, such as a worm's eye view looking up at the tree from the ground, or a bird's eye view looking down on a forest of trees from above. When you're faced with a creative challenge, you should do the same thing that we did here. It's best to start with the most familiar perspective and then expand from there. A few ways to think about perspective are to consider the people involved in the situation and what they might see, think, feel, and do, or to think about things in terms of your five senses, among many other ways to view your perspective. So now we're ready to talk about creativity and innovation processes. Over the last 70 years, a number of different methods and tools have been created. They differ somewhat, but all really have some similar elements as well. There's not a single correct approach. You just need to find the one that works best for you. The process I'll be telling you about today is the creative problem-solving process, or CPS for short, which you can see illustrated here. This is an evolution of the method that was created in the 1950s by Alex Osborne. He is credited with starting the creative thinking movement, and he's the guy who coined the term brainstorming. We already do a lot of the things that we do in CPS naturally. This just provides us with a framework and some tools that can help us along the way. The CPS process is not linear. You can move freely between steps in order to meet your needs. Also, it's not only about thinking and brainstorming. Implementation and iteration are just as important. Each of the 4 stages that we'll talk about in the CPS process contains a phase of divergent thinking and a phase of convergent thinking. Divergent thinking is used to generate as many thoughts as possible without any judgment, good or bad. This is when you strive for quantity and uniqueness. Convergent thinking is used to narrow down your choices and make decisions. Judgment is allowed and expected during this phase, so you can improve or eliminate any ideas that won't work for your problem. Divergent and convergent thinking need to be kept separate from one another in the process. If you try to do both at the same time, it's like having one foot on the gas and one foot on the brake. You won't get anywhere and you'll burn out. So let's dive into the CPS process, starting with clarifying. During this stage, you want to identify, explore, and sharpen your awareness of your goal, wish, or challenge. To avoid confusion, I'll just refer to this as a challenge as we go along, but just keep in mind that it may be a goal or wish as well. The clarifying stage is a crucial part of the CPS process because if you don't accurately identify your challenge up front, you'll end up creating solutions for the wrong problem in the end. This stage is broken down into 3 steps. First, you explore the vision. Second, you gather data. And third, you formulate challenges. When you explore the vision, you want to identify the ideal future related to your challenge. A simple tool to use here is the statement starter, "It would be great if," and then you just fill in the blank. For example, if you're struggling with the timeout process prior to surgery, your statement could be something like, "It would be great if a full, complete, and meaningful timeout was done before every single surgery in this facility." The second step here is to gather data. This is where you research the challenge so that you understand it better. The amount of research you'll need to do will really depend on your challenge. It could be as simple as a quick Google search, or you might need to do more intensive research like observations and interviews. Finally, the third step is to formulate your challenge. By this time in the process, you'll have a pretty good understanding of your challenge, and you'll need to determine where to focus so that you can have the greatest impact. You can do this by reframing your challenge into the form of an open-ended catalytic question that will encourage ideas. Some phrases you can use to start your question are, "How might we?" or "What are all the ways to?" or "In what ways might I?" Let me give you a simple real-life example to explain how this works. Let's say you really want to take a trip to Australia, but you have some financial constraints. You might normally say something like, "It's too expensive." In order to reframe your problem and invite potential solutions, you would instead want to ask a question something like, "How might we make a vacation to Australia more affordable?" This naturally gets you thinking about ideas and can be a powerful way to shift your view of the challenge. I really think this is the most crucial step because the way you frame your catalytic question will impact your mindset and guide your thoughts throughout the rest of the process. You also need to be sure to keep any potential solutions out of the catalytic question. And here's a perfect example why. So after NASA started sending people into space, they realized that pens didn't work well in space because the ink didn't flow in zero gravity. So they gathered a group of engineers and spent millions of dollars over a period of many years to develop what became known as a space pen. The pen was impressive and effective. It wrote upside down, underwater, and on all types of surfaces. However, the Soviets had also been working on the same problem and came up with a much less expensive solution much more quickly. They used pencils. Based on NASA's solution, I would guess their catalytic question sounded something like, "How might we make a pen write in zero gravity?" As you can see, by including the word pen in the question, they really limited their ability to come up with new ideas. A better way to word the question would have been, "How might we write in zero gravity?" You can see how this simple change opens this challenge up to so many more ideas. To help illustrate how this might be used to solve a patient safety challenge, let's say you're having trouble with patients slipping in the shower. You know that anti-slip socks work pretty well to prevent falls on dry surfaces, so you come up with your catalytic question for this challenge, and you ask, "How might we make anti-slip socks for the shower?" By including the word anti-slip socks, you've built in a solution and limited your potential for new ideas. So instead, what would be a better way to word this question? You just want to keep it simple. You want to remove that potential solution and ask, how might we make it impossible to slip in the shower? Now we move to the second stage of the CPS process, which is ideating. During this stage, you answer the catalytic question by generating lots of ideas. This is what we commonly refer to as brainstorming. There are many tools that can help you with brainstorming, even if you normally struggle to come up with ideas. Unfortunately, we can't get into detail about these tools today, but it's something we can do in the future if you're interested. And you can also find a lot of these tools by searching for them online. For today, I'll just mention two of my favorite tools, which are forced associations and assumption reversal. Forced associations help us to change our perspective and overcome cognitive biases. And assumption reversal does just as it sounds. It helps us to come up with new ideas by supposing the opposite of our common assumption is actually true. Once you have a lot of ideas, you'll need to narrow them down and choose one or a few of the best. It's important to recognize that each of these stages don't have to be conducted formally within the context of the larger CPS process. For instance, the chart you see here is an example of how ideating can be built into daily work. This idea board was put up in the Medical Acute Care Unit at Hebrew Rehabilitation Center back in 2015. The board itself is simple and contains 4 columns with headings for ideas, to do, doing, and done. When the board was created, it was intended to address workflow issues, but since that time, it's helped to do so much more, including numerous patient safety improvements throughout the unit. On to the third stage, which is the development stage. During this stage, you'll strengthen your ideas by bringing together novelty and usefulness and turn them into workable solutions for your challenge. You should also go back to the vision statement you created during the first stage of the process and make sure that your potential solution actually still fits your challenge. A helpful tool to guide you through this stage is known as GPS, which stands for Good Problem Solution. This tool helps you to keep what's good about an idea while also solving any problems that are associated with it. By doing this, you may also come up with a totally new idea that's even better than the one that you had to begin with. If you enter this stage with a number of strong ideas, you might want to ask each member of the team to take an idea and form a small subgroup with new members. A multidisciplinary group can also be very effective during this stage because of the unique perspective that each person can bring to the table. We really should be doing this more in healthcare because it's incredibly powerful. Though you need to spend enough time to fully develop your solution, you also need to be sure that you don't get hung up in this stage for too long. If you seek perfection, you'll never implement your solution. In order to achieve innovation, you have to know when the solution is good enough. The final stage of CPS, implementation, is absolutely necessary in order to get your solution off the ground. This is where you translate your solutions into action by identifying resources, exploring acceptance, identifying ways to overcome resistance, and creating and executing a project plan. Effective project management and change management are keys to success during this stage as well. Many of us who work in healthcare are familiar with creating or executing project plans and know that it can be exciting and intimidating at the same time. To maintain the excitement and tame the intimidation, it's very helpful to break a project down into smaller, manageable tasks. Some of the things you'll want to ask yourself as you create the project plan are, who should be involved? When should the solution be implemented? What communications need to occur? What might help or hinder the plan? And what else is going on that might have an impact? As with the other stages of CPS, the scale and speed of this stage will depend on the size and complexity of the project. For example, if NASA had come up with the pencil idea for writing in space, implementation would have been a breeze. To help you see the big picture of the CPS process, I'd like to share a story with you that pulls this all together. I came across something that I find to be very innovative, but I'm not sure where it originated or how it came to be. So I've decided to create my own story about how a team came up with this solution. So just to be clear, this is all from my imagination. A team of staff members from the dementia unit of a nursing home were very concerned about the doors on the unit. They felt the doors presented serious safety and health risks for their residents and themselves because residents would often exhibit exit-seeking behaviors when they encountered the doors, which caused them to bang on the doors, and they would become agitated and aggressive with the staff. The team started by exploring the vision in order to clarify their challenge and came up with the following vision statement. It would be great if the doors to the unit never provoked exit-seeking behavior for our residents. The team then reviewed some literature but didn't find any new practices to reduce the exit-seeking behavior, so they gathered additional information by doing observations and interviews on the unit. At that point, they were ready to formulate their challenge and came up with the following catalytic question. In what ways might we prevent our residents from viewing the doors as a means of exit? The team then did some brainstorming and came up with over 100 ideas, one of which stood out above the rest, even though it was kind of crazy. And that idea was to get rid of the doors altogether. The team recognized the obvious issues with this idea and talked about why they liked it. they realized that they liked the essence of the idea, which was that they wanted the doors to be invisible to the residents. So they decided to reframe their question to, in what ways might we make the doors invisible to our residents? From there, the team went back to ideating and came up with even more ideas. From their new list of ideas, the one that really stood out was to mount a bookshelf on the doors. Again, they realized there were some issues with this idea, but they thought they were really onto something, so they decided to move on to the development stage to address their concerns and strengthen that idea. At that stage, the team invited a few additional people to the table for diversity and perspective and to help finalize their solution. After discussing the challenge and the group's idea, one of the new team members shared that he had just installed a decal on the door of his son's room, and it was very lifelike, so he suggested that they consider something like that. The team really liked the idea and agreed to move forward. From there, they worked through a few remaining concerns about the decal idea, such as regulatory requirements, cleaning, and durability, and strengthened their solution all along the way. After getting buy-in from facility administrators, they created and executed a project plan, and their solution was fully implemented. Not only did the team's solution disguise the doors and prevent exit-seeking behaviors, but it also added a home-like feel that brought beauty to their setting. As I mentioned before, this innovation actually exists. Some of you might even have something like this in your facilities. What I really like about this solution is that it's simple. While high-tech solutions are great, not all innovations have to involve technology. So as we wrap up today, I'd like to leave you with a few things to think about. If you're afraid of creativity, ask yourself, what's the worst that could happen? Then consider what great things might happen if you take a chance. Remember our human tendency toward bias and fight against groupthink by freely sharing your unique ideas. You just might start a whole new conversation. Start challenging assumptions that you've never thought twice about in the past. And think about the tree example and shift your perspective whenever possible. Invite diversity and bring people with different perspectives to the table as often as you can. You'll really be amazed at what you discover. So what can you do to start down the road to innovation today? And how can we help you get there? Our patients deserve for us to put creativity to work to provide better and safer healthcare. So I encourage all of you to fight against the urge to stick with the procession, and I challenge you to think differently and open the door to breakthrough innovations.
Thanks, Becky. That was a great presentation that contained valuable information everyone can use in their organization. I want to thank everyone for joining us today. This concludes our webinar.